Good morning, NBMC. It's a pleasure for me to be part of the first ever online NBMC conference. The title of my paper is vadis COVID-19, where is COVID-19 headed, with a subtitle of In Search of Macro Variables per Country to explain its spread through regression and correlation analysis. COVID-19, since it was declared a pandemic in March 2020, has severely affected the livelihood as well as well-being of people worldwide. As of 8 November 2020, the date when data gathering was made for the study, 49.9 million cases have been recorded with 32.6 million recoveries. However, 1,243,000 deaths were also recorded, and the top 20 countries in terms of cases accounted for 80% of all the cases worldwide. The objective of this study is really simple: to be able to contribute to the research and papers written about COVID-19 to understand the reasons for the spread of the virus. The slide shows the top 20 countries with COVID cases as of November 8, 2020, the countries of interest in this study. In terms of location, 9 of the countries came from Europe, 5 from South America, 3 from Asia, 2 from North America, and 1 from Africa. The top 3 countries, USA, India, and Brazil, accounted for 48% of the total cases worldwide. China, where the COVID case first was reported, was 56th in terms of ranking with just 92,000 cases. The Philippines, with 396,000 cases, was 25th ranked worldwide. The author identified 12 macro variables, all from secondary sources, about the 20 countries listed in the previous slide, which may have an impact on COVID-19 cases. Of the 12 variables, 7 were hypothesized to have a positive impact. They were population density, GNI per capita, stocks traded as percent of GDP, mortality rate, passengers carried through air transport, and temperate countries. This means that, for example, in population, as population increases, the number of COVID cases are also expected to increase. 5 other variables have an inverse impact. They were unemployment, number of doctors, number of hospital beds, health expenditure as percent of GDP, and literacy rate. It was hypothesized that these 5 variables, as they increase, they will result to the decrease in COVID cases. For example, if there are more doctors in a particular country, it's expected that there will be less COVID cases because they can properly handle the COVID cases in that country. Regression and correlation analysis was employed to determine which among the 12 variables initially listed have a significant relationship with COVID cases. Among the 12, 3 were surfaced as with significant relationship: air transport passengers carried with an R value of 0.784, population with an R value of 0.736, and stocks traded as percent of GDP with an R value of 0.516. Both air transport and population data were significant at 99%, while stocks traded was significant at 95%. However, air transport, passengers carried, and stocks traded have a significant correlation value of 0.657, significant at 99%. To avoid multicollinearity, either one can be dropped and the remaining variable can be sufficient to explain the dependent variable, in this case COVID-19 cases. So we're going to retain in the model air transport passengers carried, since it has a higher R value of 0.784 compared to stocks traded at 0.516. The final regression model has 2 independent variables: air transport passengers carried and population. And you can see from this particular slide The correlation coefficient is 0.948 or about 95%, a very strong linear relationship between the variables. And the coefficient of determination is 0.898 or about 90% of the changes in COVID-19 cases can be explained by the two independent variables in the model. Now, in this particular regression model, you can see that as air transport passengers increases by 1,000, you expect to increase the number of COVID cases by 9, while as population increases by 100,000, the number of cases will increase also by 5. The regression model is significant at 99%. For my conclusion, government should consider looking at policies and procedures to minimize the impact of spreading COVID-19 through air transport passengers. Actually, not only for air transport, but all other forms of mass transport like the use of trains and buses. Among other measures, it can limit the passenger capacity of aircraft, conduct tests among departing and arriving passengers, the use of face masks and face shields as mandatory, limiting air travel to important destinations for the time being that we are trying to control the spread of the virus, as well as contact tracing. The general movement of the population should also continue to be controlled and monitored to curtail the virus spread. Limiting movements to identified industries where work from home may not be practical can be prioritized. Non-essential travel and social activities can be limited. Online and modular learning should be the norm as long as an effective vaccine has not been developed. Non-face-to-face processes and other digitally enabled interventions should be continued. Cooperation among the general population is needed to control the virus spread. The study can be expanded to include the next 20 countries to provide more expanded viewpoint in terms of experience of spread of COVID-19, as well as look for other macro variables which might contribute further to the understanding of the spread of COVID-19. With this, I thank you and I wish everyone a good day.